Hey Guru Nation, I wanted to talk to you about, we actually just did episode 188 of Random Musings from the Clinical Trials Guru. It was about PI ethical considerations and coercion and oversight and not using their influence to unfairly persuade their patients when they're the treating physician to join studies, which are problems that apparently academic institutions have and hospital research institutions have, but not the problems that private research sites have. As a matter of fact, on the private side, from my experiences, unless the PI is an owner of the site, and even when they are an owner of the site, it's actually hard to get them engaged in referring patients. It's like the opposite extreme. At an academic institution, at a university, you know, the influence of the PI comes into question. There might be some ethical issues there with coercion and maybe changing treatment so somebody fits into a study. We talk about that in episode 188, but I just wanted to talk to you about the strategies you can use, because normally I talk about how to get your PIs more engaged, more involved, interested in referring patients, which you should do. But on the other hand, I've never done a video on how to educate your PI, even though they're supposed to learn this from the Declaration of Helsinki and good clinical practice. Educate them on their responsibilities to make sure that they're not using their influence to coerce patients to join studies, and that they're not changing treatments in the middle of pre-screening. Or a perfect example of this would be looking at a exclusion criteria and then not prescribing a medication during the normal course of treatment just because it would be a prohibited med for a study. So the best way to prevent this is to over-document the fact that the PI has discussed all available options and alternatives with the patient, and that they did not influence the patient at all in their decision to join the clinical trial. So when in doubt, over-document. Even on the other side, I mean, you can never go wrong with over-documentation and writing down, documenting your reasons and what's going on as far as the PI when it comes to consenting process and when it comes to selecting patients. So just something that I wanted to talk to you about, and you can definitely go check out more of it on Random Musings from the Clinical Trials Guru, episode 188. Take care.